In trying to explain the value of evidence-based medicine and the need for a scientific approach to evaluating medical therapies, I often run up against the challenge that individual clinicians' experience with therapies shows them quite clearly what works and what doesn't, and there's no need for additional scientific research into those particular therapies. And this is true for all kinds of therapies. It seems to be especially true for alternative therapies. And I think part of the problem is that most of us are not sufficiently aware of the limitations of our clinical experience, of the weaknesses in the way that we make those kinds of judgments that make us really in desperate need of better, more objective scientific evaluation. So I just want to talk briefly about some of the limitations of clinical experience. Richard Feynman, who's a well-known physicist and undoubtedly a brilliant man, said the first principle in doing research is that you must not fool yourself, and you are the easiest person to fool. And I think it was an element of his genius that he recognized that even as an incredibly bright and very experienced scientist, he knew that he was easy to fool, as we all are. I'm also old enough to remember this book, and this is a slightly more poetic way of saying the same thing. The real purpose of the scientific method is to make sure nature hasn't misled you into thinking you know something you don't actually know. And that is something that I think happens all the time. We are often misled by nature and by the characteristics of our own brains into thinking we know things when we don't really. So why do we get things wrong? In a very general sense. There's a rich cognitive psychology literature that looks at all the specific errors that we make. But in a general sense, there are some big categories for how we get things wrong. Some of them have to do with the nature of the diseases that we're investigating or treating. Many of them, as I think most of us will admit, probably get better by themselves, regardless of what we do. And that fact is one way that we get fooled, because we will see a patient who has a set of symptoms, treat that patient, the patient will get better, and we will be inclined to take the credit for that when perhaps we don't really need that credit because we haven't earned it. The process of rigorous, controlled scientific evaluation is going to identify the difference between patients getting better spontaneously and getting better as a result of an intervention, whereas our individual clinical experience often will not. Similarly, chronic diseases, which are some of the most frustrating because we don't have good solutions to them, they wouldn't be chronic if we could fix them, are diseases in which the symptoms come and go. Sometimes they're better, sometimes they're worse. When do people go to the doctor or take their pets to the doctor? When the symptoms are getting to be their worst. You don't go to the doctor when you're feeling particularly good that day. You go when your problem, if it's a chronic problem, it has been building over time and is starting to peak. So for diseases in which the symptoms get worse for a while, peak, and then get better and go up and down like that, the fact is that oftentimes they come in at their worst and they're going to get better regardless of what you do. And this phenomenon is known as regression to the mean. It's one of the ways that, particularly with chronic diseases, which are often a target of alternative therapies, because they are not something that we have excellent solutions for in conventional medicine yet, this process tends to lead us to think that whatever the last thing we did is responsible for an improvement when it may in fact be spontaneous. Placebo effects. In veterinary medicine, there's some debate about what this means or whether it's relevant. I think it's clear that the classic placebo in which a patient subjectively feels improved even if their disease is not actually improved because they expect or believe that they're getting an effective therapy. I think it's clear that probably doesn't happen with our patients. They don't have a lot of expectations or beliefs about their disease or their treatment. I think it certainly happens with us as veterinarians and absolutely with our clients, who will be looking for improvement when we give them a therapy which we confidently tell them will help to make their pets better. So the placebo by proxy effect, I think, is a real one. Placebo controls in research trials are also aimed at looking at taking out the effects of a number of other kinds of biases. The fact, for example, that when a person is participating in a clinical trial, they take their other medications more reliably, they're seen by doctors and treated more carefully, and they have a tendency to improve overall, regardless of whether they're in the placebo or the treatment arm of the particular trial, because they're getting better care. And that is a so-called placebo effect, though it's not the classic expectation-based effect. And I think those things can influence the appearance of improvement in patients when we're not doing good controlled clinical research. And confirmation bias is a problem that bedevils us in all areas of reasoning. We tend to see what we expect and what we want to see. We're very good at ignoring facts that would require us to reevaluate or reject our pre-existing beliefs. And this, again, is something well established in psychology and plays an important role in our difficulty in coming to the right conclusions based solely on clinical experience. Cognitive dissonance is a very similar phenomenon in which it is difficult for us to accept that deeply held beliefs which are important to our sense of our identity are wrong. And particularly when you have a belief in something that is alternative and is not widely held, that you have struggled to promote and to put forward despite resistance, and that you have made a part of the everyday sort of fabric of your life, if you suddenly come across information that questions that belief and makes you consider perhaps rejecting it and starting over, well, that's a very difficult thing to do, and human beings have a well-established tendency to ignore things that would require that quite painful adjustment of belief. So what's the bad news? The bad news is that all of these things happen to all of us, and being smart, being well-educated, being a very experienced clinician, and being a really good person who means well, none of those things protect us from these kinds of common sources of error. And I think that's why it's important that Feynman, who was all of those things, smart and educated and experienced, recognized that we are all susceptible to these kinds of errors. And this means that we have to recognize that the judgment of individuals, no matter how smart they are, is less reliable than the judgment of good quality objective scientific research. And it doesn't really make much difference how many individuals believe in something. The number of people who believe in an idea is not a reliable indicator that that idea is true, because each of us individually is susceptible to these sort of limitations, and the aggregate of our individual fallibility is still fallible reasoning. Now, what's the good news? Science works. There's no question that it is imperfect, like all human endeavors, but it is much better at compensating for the limitations in our individual reasoning ability than just willpower or our own unsystematic efforts to compensate for them. And that is why the health and life expectancy and quality of life for human beings has improved so dramatically in the last couple of centuries, well beyond anything, previously seen. All of the unsystematic approaches to figuring out how things work and to changing them in terms of health and disease were, over thousands of years, definitively less effective than the outcome of applying the scientific method to all aspects of health and well-being. So I think science, while inarguably imperfect, works pretty darn well. I want to give you one example of the dangers of relying on clinical experience and individual reasoning rather than controlled scientific research. There are many such examples, but this is, I think, a particularly poignant one. Dr. Benjamin Spock was a pediatrician who, in 1946, published this book, Baby and Child Care, and he was undoubtedly a bright man, an excellent doctor, a caring clinician, and an articulate spokesperson for his beliefs about child rearing. And this became probably the first true manual for parenting. It was widely distributed and sold all over the world. This book, by 1973, had gone through 200 printings and sold millions of copies, translated into many languages, and was, probably one of the best-known books in the English-speaking world. Individuals who read this book and used it to help them parent had overall very positive responses. This person says, that I see your book as the Bible of American parenthood. People said, I don't know what I admire, any book I admire more. And Dr. Spock himself wrote that every time the supply of the book runs out, I get pleas, not only from parents and other people interested in individual child rearing, but from schools of social work, medical schools, teacher training schools, even public health departments who routinely give this book out to new parents. It was widely accepted as an authoritative and definitive resource for parenting. So here's one piece of advice that was in Dr. Spock's Baby and Child Care. He was concerned with helping people prevent sudden infant death syndrome, or crib death, which was a terrifying and poorly understood phenomenon in which young children, typically under a year, though sometimes older, and in every apparent way completely healthy, would suddenly die. And obviously this is a nightmare for any parent, and Dr. Spock had some ideas about the best way to prevent this. His advice was that you should put your babies to sleep on their stomach rather than on their back. And this advice was generated by his own experience and some fairly sound reasoning. His comment on the subject was, there are two disadvantages to a baby sleeping on his back. If he vomits, he's more likely to choke on the vomitus, and also he tends to keep his head turned to the same side, and this may flatten that side of his head. I think it is preferable to accustom a baby to sleeping on his stomach from the start if he's willing. And that makes a lot of sense. Anyone who's had an infant in their lives knows that infants do vomit fairly frequently, and the concern about aspiration is quite reasonable. Dr. Spock himself said that the concern about the flattening of the head was not a very significant one, since that tended to straighten out in the growth process. But overall, he felt like it was safer to put children to sleep on their stomach. So here's the problem. This study, published in the UK in the early 2000s, reviewed both recommendations, such as Dr. Spock's, which was probably the most influential recommendation on how to put babies to sleep, and also systematic research on sudden infant death syndrome and sleeping position. And the review concludes that from 1970 forward, there was excellent scientific evidence that putting babies to sleep on their stomach actually increased the risk of sudden infant death syndrome compared to putting them to sleep on their back. So Dr. Spock's argument about putting them to sleep on their back increasing SIDS deaths was actually mistaken. Perfectly reasonable, but was wrong based on the scientific evidence. However, for quite some time, people didn't follow the scientific consensus. Instead, they followed the advice of individuals that they trusted and respected, like Dr. Spock. And according to this paper, if we had paid attention to that research when it became available starting in the early 70s, it is possible that we could have prevented over 10,000 infant deaths in the UK and at least 50,000 in Europe, the US, and Australasia. So that's a huge number of children who died most likely unnecessarily as a result of sleeping practices that were based not on the available scientific research, which was there, but on the experience and recommendations of individual physicians and others. This is a figure from that same paper. The pink line represents the prevalence of people putting their babies to sleep on their stomach. And in 1991, in the UK, there was a deliberate government campaign to teach parents that it was better and safer to put their babies to sleep on their back. So you can see that from the early 1990s onward, the prevalence of people who put their babies to sleep on their stomach went down dramatically as a result of this public education campaign. The blue line represents the rate of sudden infant death syndrome. And what you can see is that there is a very closely parallel and precipitous decrease in the SIDS death rate associated with this public education campaign, and with a decrease in the number of babies put to sleep on their belly. So this is pretty compelling evidence that many lives were saved by changing this practice based on scientific research, and sadly many lives were lost by persisting in the practice of putting babies to sleep on their belly despite scientific research that that practice was dangerous. Which brings me to my conclusion. The three most dangerous words in medicine are "in my experience." It's not that the experience of individual clinicians isn't valuable. It absolutely is essential and indispensable in good quality medicine. However, when we justify a practice in terms of our individual clinical experience, particularly when we do so in the face of contradictory scientific evidence, we are relying on a less trustworthy and less accurate source of information. And I think we run the risk of making decisions, as we did in the case of sudden infant death syndrome, that are bad decisions and dangerous. And the problem is that individual experience and personal narratives are often more convincing and more compelling than the rather dry and complex and sometimes ambiguous findings of formal systematic scientific research. But I think there are many examples other than that of Dr. Spock and sudden infant death syndrome that show that individual experience fundamentally is less reliable than good quality, high-level research. And it behooves us as clinicians to have the humility to accept that and to recognize that relying on our own experience is insufficient to provide the optimal care for our patients that we'd like to provide.